Try to use your car less, so use alternative forms of transportation, whether that be bicycle or walking or public transport. Also, if you have the means to use either hybrid or electric vehicles, that's an option, or just alternative energies, solar power, things like that are things you can do.
So that was not an environmental or climate scientist, but Dr. Erin Levy, an Atrium Health pediatrician who's prescribing electric vehicles as medicine for good health.
A prescription for a Tesla. That's how I just heard it right there. Meteorologist Elisa Raffa joining us here in the studio, continuing her power progress this week, teaching us everything about EV. This is fascinating, Elisa.
Isn't that so cool? I interviewed a climate scientist and like a pediatrician, and they had similar sounding advice. It was so interesting to hear just the way that the poor air quality really impacts our health.
Because we all breathe this in.
We breathe it in every single day. And if we look at some of the numbers here, I mean, most of our poor air quality comes from those mobile sources, the cars, trucks, planes, and trains. Right here in Mecklenburg County, that number is 60%. 60% of that poor air quality comes from the cars and trucks. And what happens is all that stuff comes out of the tailpipe, and then especially in these months where it's hot and sticky, the sunlight hits it and it kind of traps all of that pollution right around our heads and creates low-level ozone, which is that poor air quality. It's when we get those air quality alert days. So again, the sources coming from our transportation create the smog, the greenhouse gases. So that solution is to go electric, to eliminate those tailpipes. And look at this graphic. It's just really fascinating. A study done by scientists at Princeton University found that we will save thousands of lives from cleaner air by using electric vehicles. By 2050 in North Carolina, we'll save more than 4,000 lives just by electrifying transportation. And that's also going to save us money when it comes to health costs. We're talking about saving $9 million in healthcare costs by going electric, because that air quality is just going to be so much better. Here's Dr. Erin Levy again. He's a pediatrician with Atrium Health.
In the older population, people with chronic lung disease, people with heart disease, vascular disease, those kinds of things, we know there's a direct link between some of these environmental factors and poor air quality and their health.
So again, pretty fascinating, right? Just the way that he talked about air quality in electric vehicles, it sounded so much from what I've heard for years from climate scientists, and he actually teaches medical students classes in climate change and health.
And that's the focus of your piece
tonight. Tonight, yes. We'll kind of be diving deeper into some of the health aspects and how CATS is putting electric buses on the roads to help clean up our air.
Well, and shame on me for not, because we don't see the quality of our air unless it's really bad.
Yeah.
You can see smog in a lot of different cities around the world. We don't think of it in the Queen City as much, but when I see a big diesel truck or a bus hit the accelerator and the black smoke comes out, that's the only time I think about it. I don't think about my everyday commute and how that's even affecting one car at a time.
Just kind of breathing it in on the highways all the time.
Carpool, walk if you don't have to drive, all those things.
Doctor said so. Apple a day, right?
That's right.
All right, Elisa, we look forward to that piece tonight at 10.